I'd now like to introduce our next speaker, Brooke Rankmore, who's going to talk about partnering to deliver companion animal management in remote Indigenous communities. Brooke has a passion for rural and remote Australia, and she's lived in the Northern Territory for 20 years, including 5 years living remotely. She has a Doctor of Philosophy and extensive experience in conservation and natural resources management across the top end. She's held positions in Regional Development Australia, NT, Greening Australia, and the City of Darwin, where she oversaw regulatory services, including animal management. Brooke commenced her role with AMRRIC in February 2018 and is proud to lead AMRRIC into the future, working with the board, staff, partners, and communities to improve service delivery and education for companion animals. Thank you, Brooke.
Thanks, everyone. It's good to see so many of you still here on the last day, especially after a late night for many of us last night. So firstly, I'd like to acknowledge, and I'm going to probably pronounce this incorrectly, but the Yugambeh people, the traditional custodians of the land. I pay respect to their elders, past, present, and emerging, and thank them for their important contribution to our culturally rich nation. I'd also like to acknowledge all of the Aboriginal and Torres Strait Islander communities in which we have the privilege of working. So AMRRIC, Animal Management in Rural and Remote Indigenous Communities. You can see why we've shortened it to call ourselves AMRRIC. We're a national not-for-profit that uses a One Health approach to coordinate veterinary and education programs in rural and remote Indigenous communities. One Health recognises the intrinsic links between human, animal and environmental health and well-being. Working in remote communities to improve the health of their companion animals is helping to create healthier, safer and happy communities. We're a small team of 5, soon to be increasing due to additional funding provided by the federal government through the Indigenous Advancement Strategy. So just to give you an overview of what I'm going to talk about today, I'm just going to give a basic introduction into the what creates effective companion animal management, impacts that we see in our Indigenous communities of unmanaged populations, how we're delivering animal management in remote communities and how that might differ to what you see on a daily basis, and the ways in which AMRRIC is working with councils. So we do work with veterinary service providers and a whole range of stakeholders, but today I'm just focusing on our work with councils. So like us, Indigenous people have for a very long time had dogs, and now more recently cats, as companion animals. So prior to the dog, the dingo was still a very integral part of Indigenous communities. So not only are they companions, but they're also, in some areas, integrated into kinship systems. So there are dog song lines, etc. They're used for hunting in cold areas in the desert. They're used as a source of warmth, so people huddle on their bedding with their animals for warmth. And they're also used for protection, not just physical, but also spiritual. So there's, in Indigenous culture, there is a lot of spirituality, and they believe that their dogs provide protection in that way as well. Okay, so what I just wanted to do is, while there are potentially other contributing factors, I just wanted to look at some key determinants of effective animal management. So starting with access to services. Access to services provides happy, healthy pets, and owners are able to provide for the pet needs. Then we have the socio-economic status of the community and their financial ability to pay for those services. We've got local government authorities that are resourced to implement animal management programs. And of course, responsible pet ownership. So if we take the City of Darwin, and my talk is quite NT-centric or Northern Territory-centric, because for the last 3 years we've really been, we were federally funded to provide support to the NT, and unfortunately we're probably, well behind most other states in Australia. So if we take animal management in the City of Darwin as a pretty good example of metropolitan animal management, you'd agree that most residents that own pets have access to resources. So they've got multiple vet surgeries they can visit and select their preferred vet service provider. They're also a wealth of choice when it comes to purchasing prophylactic treatments and animal care products. Thanks to their ratepayer base, the council has a healthy budget for animal management. They've got existing bylaws in place, regulation systems, pounds, and a range of animal management equipment, as well as a number of experienced staff that are able to undertake animal management activities. All these things enable the City of Darwin to implement effective animal management programs. Now, if we take the scenario occurring in the majority of our Indigenous communities, access to resources. So there's geographic and economic issues with access to veterinary services, prophylactic treatments, and animal care products. If you go into a shop in an Indigenous community, you will not find, well, most of them, you won't find any prophylactic products for purchase. And even if they are there, people don't purchase them because they actually don't know what they do, and so they sit on the shelves. We then have a theme that's been running through the conference, and that is more support needed for communities with low socioeconomic areas. Our Indigenous communities suffer not only from isolation, but also from really high levels of socioeconomic disadvantage, with the majority of the community on welfare. Local government authorities that are resourced and have knowledge to implement appropriate animal management programs. These resources could be financial, human, and physical. Currently, in the NT, there's no overarching companion animal management legislation, and animal management bylaws don't exist in regional areas of the NT. They've got a limited ratepayer base. In some councils, none of their communities actually pay rates. And they're over vast distances. There's massive staff turnover in local government in the NT, and the roles require specialised knowledge, of which there is little. And they just don't have the infrastructure available, and it's not possible to share it across such large distances. And then thirdly, a culture that generally adheres to local bylaws, if there were some, and is encouraged and understands the concept of a responsible pet ownership. So of course, education and relationships play a major key here. So you can see the differences really are that for municipal councils, they're operating in the space of responsible pet ownership, in that regulatory space that the majority of councils that you would work with. However, in remote areas, it's actually providing the access to services. And of course, this access has to be provided freely. So, to give you an example, providing access is expensive for councils, and for many communities, they're lucky if they receive vet services 1 to 3 times a year. There's still communities across Australia that have no access at all, and this is where AMRRIC's working to improve that. Now I'm just going to focus on what the lack of services results in, and I'll move through this quickly because I want to sort of get to the end of what I want to talk about. So the first one's overpopulation. And of course, if you don't have if there's no vet service provider visiting the community, then of course you're getting huge issues with overpopulation, which then contributes to deteriorating health due to fewer resources and things being spread thinly. There's negative welfare impacts extend to humans too, and the helplessness and stress felt by the community members as their animals have litter after litter with no more evidently, explained than through this statement by a lovely old lady from Maningrida. So of course parasites are also prevalent in Indigenous communities, and in tropical conditions like Darwin and Northern Australia, tick infestations like this can actually happen quite quickly. And of course, internal parasite issues as well, that we wouldn't necessarily see, but of course no access to prophylactic medication is available. Zoonoses, so of course scabies here, are still relatively common. It's definitely reduced, so we don't see what we used to call leatherback dogs, used to be really prolific in communities, and now they're rare. However, it is still occurring. And while dog scabies is not the same as human scabies, people who are living in close association with mangy dogs, and often Indigenous communities suffer from extensive overcrowding with more than 20 people living in a house, then they're likely to get recurring transient infections that lead to all sorts of nasty consequences like skin sores and rheumatic heart disease and renal failure. So the Northern Territory this year, if you've seen it in the media, there's been a lot of discussion about rheumatic heart disease, and that Maningrida in central Arnhem Land has the highest rates in the world of rheumatic heart disease. Of course, we have welfare issues. So this poor guy had been in a fight, I think. Oh, already, yep. And luckily the vet was there. So it's sort of, if something happens to your dog, it's see how he goes and hope that it repairs itself. TVTs, TVTs, so canine transmittable venereal tumours are still seen in communities. And of course there is animal welfare issues, some of it due to lack of education and some intentional, just like we see in all of our communities. Litter is another environmental health issue that the dogs contribute to, spreading litter around and scavenging for scraps and depositing faeces all over the community. Of course, when you get large populations of dogs, they can cause great nuisance from noise, barking, fighting and mating, and that tends to raise tension in communities. And of course, threat from attack from cheeky dogs. So AMRRIC's role is really as a knowledge broker for local government authorities and animal management staff. We also work with veterinary service providers and stakeholders impacted by or with an interest. We're primarily funded to facilitate animal management and health programs, coordinate with local government authorities and veterinary service providers to support existing programs and facilitate programs where none exist. Support and facilitate community and school-based education programs and collate data and sort of provide that overarching view of what's happening. So working with local government, we deliver, coordinate and facilitate vet service and education programs. We assist in implementing animal management strategies and programs, partner to secure funding for animal management programs. We advocate, build capacity and capability, connect. So really, I think I call us a gap filler. We'll just fill any gap that's needed in the community. Vet services. So there's varying levels of AMRRIC involvement depending on what's needed, from linking councils with vet service providers that are working in the space to completely managing an entire sort of animal management program for a council. These programs, we can enhance existing programs through providing volunteers. And so if anyone's interested, we have a volunteer program. Jump on the website and register as a volunteer. Councils basically pay, the process is councils pay for the principal service, veterinary service provider, which usually includes the price of the vet nurse, drugs and kit, and then we enhance the programs with additional vets and vet nurses to dissex more animals while we're out there. This is my area of interest, being a research scientist, is about data collection. So when I started with AMRRIC in February last year, all of our councils that I went to, if I said, what are your dog populations, they couldn't answer it. If I asked what you just sex rated those populations, they didn't know. It was really a case of just saying, we need to deliver vet services, send the vet out, I've ticked the box, with little understanding of what it was that they needed the vet to do, etc. So What we're focusing on now is actually working with a number of councils to be more strategic, to make sure that they're using their limited funds appropriately. Our first one that I want to show you is with Central Desert Regional Council. Now, they cover an area of 282,000 square kilometres. For the visitors from America in the room, that's over 109,000 square miles. And in comparison, it's larger than the size of Victoria. So as highlighted, many of these small councils don't have the internal resources and knowledge. So what we've done is undertake a census of 9 communities, and I'm just going to show a little video. Okay, I'm going to keep moving because I'm running out of time. But that just gives you a snapshot, and basically what we're going to do is work with the council now that we've got a census, we've got the baseline data for them of what their communities are and what their sex rates are, and we're going to work with them to develop up a 3-year strategy of where they need to prioritise what they're doing and how to spend their money. Okay, education is another aspect. So not only I have an education officer who's a qualified teacher. We develop resources as well as actually deliver education in schools. And we're also really focusing now on education in the community. So when we do a census, we're going door to door, we're handing out ivermectin sandwiches and worming them as we go. We're talking, we're collecting a vet list, we're maximising every minute that we're in community. So this is just one of our education kits that we created with Four Paws Australia, and we deliver these out into communities so that actually people can undertake the education themselves. But we also have a whole range of free resources available on our website if anyone wants them, and they could be useful for all of you. Here's an example of one of our education programs. All right, so the other bit is building capacity and building local capacity, allowing and trying to educate people in communities so that actually work can be being undertaken, like worming and things like that, while the vets aren't there. We had a fantastic program called our Animal Management Worker Program, and I've talked to a few people here about it that know of the program and were connected in some ways. It was a fantastic program, but once the funding finished for AMRRIC to be involved, unfortunately what happened is they all fell over due to a lack of capacity in council to support these guys. So moving forward, and you would have just seen it in that video, we're actually looking at working with Indigenous ranger groups, which have a much better established governance structure and stability. So I just wanted to show you another video, which is some training that we did recently. Okay, and as I said, AMRRIC is a bit of a gap filler. So really, if there's an animal management issue in remote communities, we tackle it. And earlier this year, there was a cyclone in the Northern Territory, and we were brought in as part of the emergency response, the animal welfare emergency response. So I'll just show you about that one too. Okay, so I'm out of time. Quickly, we support research as well, so work with a whole range of universities and researchers to collect information, capture data. We're working in the advocacy space, obviously, trying to improve environmental health, bring in NT overarching companion animal legislation, and things like this. These are actually the same dogs, only a couple of months apart, so you can see that with prophylactic treatment, what can happen. So Aboriginal and Torres Strait Islander community members get it. They inherently understand the interconnectedness of human, animal and environmental health, and they understand the health of companion animals can impact the health of their families. They want better access to services because they see the regular benefits that veterinary services provide. We just need to have changes to policy and funding models. So in closing, basically AMRRIC's been working in this space for over 15 years now, and the approaches that you can see, I won't go into them, but the approaches are there, so what we've learnt over that time. So please visit, sign up to our Facebook page to follow the work that we do. Do you want to start now with this? We'll do a poll. Yeah? Yeah, so, cool.
Sorry to cut you off.
No, it's good.
This is very important, but I've got to be very, very straight with the time. But we are going to have a quick poll about an ad. I don't know if you can play it from your device. So we're going to play an ad, and Billy will put up a quick poll afterwards about this ad.
Yeah, so basically this is an ad that AMRRIC had, that someone did for us years ago. Some of you may be aware of it. And there's going to be a quick poll on your Slido thing. I just want to see what people think of it, whether you think it encapsulates what we do.
In the heart of our country, there's something we care for that's sometimes overlooked. We help care for dogs in remote Indigenous communities. To donate or find out more, visit AMRRIC.org.
Okay, so I love it and I want to bring it out of the closet, so I just want to get some feedback as to whether you do or don't like it. So if you can go and poll for me, that'd be great. But it's been brought to my attention that there is a bit of a issue with it. So for the first person, and I'll let Anne determine, who can identify what the issue might be with it. We have an AMRRIC cap, some socks from ProSkill, and our new children's book, What Wally Needs.
We actually had first. We did half a second.
Yeah. Okay. Good. Yeah. It's a pointer, and yeah, that's the feedback, is that you won't see those in communities. But I think from that most people wouldn't actually necessarily be aware of that if they're not across what happens in communities. But yeah, if you can poll, that'd be great. Appreciate it. Thanks.